Hi, everybody, and welcome, welcome, welcome. Hi, James. Welcome to the Lafora Talk Show. Hi, Paul. Welcome to the Lafora Talk Show, Expert Edition. This is Tanya Friedman speaking. I'm the Chief Operating Officer of Kinetics USA. And I have with me Dr. James and Sir Paul, who are with us.
Hey, guys.
And excited to get started. This is season 2, episode 1 of the Lafora Talk Show, and we are back in a new format, and the format is the Expert Edition. So today we are hearing from our 2 experts, and we're really excited to be hearing a lot of information. I think there's going to be a lot of information shared today. And this is specifically, we're going to be looking at the topic, how does the NCLEX pass rate of internationally educated nurses compare to that of American trained nurses? And also, if you are a nurse who is looking to take the NCLEX, this is really for you. So we have a lot of people that are joining us. I see Pamela's joining us, KL is joining us, James is watching, Anka is joining us. Sorry, Archer is joining us. So I see that we have a lot of people joining us. If you have any questions about the NCLEX and how the pass rate of internationally educated nurses compares to American nurses, and as an international nurse, what you can do about it, this is the show for you. So we're going to get started. Before we get to the topic at hand, I know that last night, Dr. James, you and Paul were introducing yourselves, but in case somebody didn't get to watch you last night, I think it's a great idea if you maybe give us a little bit of your background about your history. Okay, over to you. Dr. James, if you want to get started.
Yeah, sure. My name is James Montegrico. I've been a nurse here in the U.S. for 19 years. I migrated in 2002. I started as staff nurse, but my heart has been in the academe, so I've been more of an educator. I am currently a faculty member at the University of North Carolina at Charlotte. I teach med-surg and I teach NCLEX. NCLEX has been a major part of my life. It has been my focus for my dissertation through my PhD years. So I am glad to share with you things that will benefit you if you're preparing for the NCLEX.
Okay, thank you so much, James. We're really excited to speak to you because I think in the literature, and we'll get into this in the next hour, we're going to be talking about this topic over the next hour. But I think that the literature is very limited. There's not a lot of information about how the pass rate compares and what internationally educated nurses can do about that to make sure that they pass the NCLEX when they take it. So I think that this is really kind of groundbreaking, what we are doing today. And I think there's going to be a lot of evidence-based research that James and Paul are going to share with you today. Paul, do you want to go ahead? And I think you probably don't need any introduction. Everybody in Lafora knows who you are. But go ahead and introduce yourself anyway.
Right. Hey, guys. Good morning from Texas. My name is Paul Bilyuan. I've been here in the States for 4 years. I've been a nurse for 14 years. I'm a doctorate student, DNP, about to graduate soon. I'm about to take my nurse practitioner board exam soon. Hoping for a good result. I've been teaching NCLEX since 2009, helped a lot of students, thousands of students to pass the NCLEX. A lot of them are here already in the United States. And today we'll be talking about stuff that will help you to pass your NCLEX exam.
All right. Thank you, Paul. We really have 2 experts with us today. And if you have any specific questions about how to go about passing the NCLEX, please put that into the chat and I will be happy to go through that with the panel and ask your questions for you.
Sorry about that.
We have, no problem. We can see this is live.
Right.
So I just wanted to also remind everybody about, before we get to, started, just about the Lafora Talk Show. So this was started last year. It was really, the intention of the Lafora Talk Show is really for nurses to help nurses. Coming to the US can be a very exciting, very rewarding, very satisfying journey, but it can feel very overwhelming. It can feel very confusing and very complicated. You're dealing with immigration, you're dealing with licensing, you're dealing with arriving in a strange country, and dealing with culture shock and all of those things that go with coming to the US. So last year we really were documenting different nurses' journeys, and this year we are going to be focusing more on specific topics that are of interest to nurses coming to the US. So if you have any ideas of topics that you would like us to cover, please let us know. We do have a format. We're going to be doing this every month with different topics and different experts. So I just wanted to make sure to share that. Now, in terms of the NCLEX, there's probably no better time for a nurse to take the NCLEX than now. Correct to the panel, right?
Right. Mm-hmm.
Yes.
And there are a few reasons for that. One is from the immigration perspective. The visa bulletin is current for anyone born in any country other than India and China, which means this is the best time to get a green card, an employment-based
Right.
green card.
Mm-hmm.
So that's the first thing. The other thing, and I think the panel will probably get into this in the session, is that I think it is in April 1st, 2023, the NCLEX is going to get more difficult, correct?
Yeah.
So
Right,
if you want to do it, now's the time to get in and do it before that changes. And I think the third reason is that the demand in the US is much, much higher now than it's ever been. I mean, I've been doing this for many years. Paul and James are both nurses that came to the US many years ago. The demand in the US is higher than it's ever been for
Right.
international nurses.
Mm-hmm.
So there's no better time to take your NCLEX. If you are watching today, please tag your friends who have not yet passed the NCLEX, pay it forward for them in the same way that Dr. James and Paul are paying it forward to you now, so that they can also hear this session. Okay, so first question. How does the NCLEX pass rate of international nurses compare to nurses who are educated in the US? So let's start with that initial kind of background question. Dr. James, maybe if you want to start with that one.
Yeah. So I've been monitoring the NCLEX performance because as an educator, we use the NCLEX as a benchmark to determine the quality of nursing programs. And as a researcher, I have compiled a lot of data regarding the NCLEX. And if briefly, I would say that even for those educated in the U.S., the average pass rates for U.S. educated nurses is about 86%. So how much more for international nurses? And unfortunately, more than half international nurses are not passing the NCLEX. And if I can share a slide to have
Yeah, go
okay,
ahead.
let me just share this. Can you guys see this?
No.
We don't see anything yet.
You don't see this slide?
No.
Oh,
James, it's the
okay. Okay, let me so sorry, let me just how about this now?
I don't think we see anything.
no.
You're not seeing anything? Okay, anyway, so that's fine. So I can just say like yeah, for international nurses, it is a challenge for them to pass the NCLEX for a lot of reasons. It can be a lot of factors that is inherent to the student. It can be for the educational program that they've had. So, in other words, it's really a challenge for international nurses. And as you have mentioned earlier, this is the best time to take the NCLEX because it's gonna be more difficult as the years and in 2 years. So there is a huge discrepancy regarding the pass rates of international nurses, especially when the NCLEX test plan changes. the pass rates fall down. Like in 2013, we saw a very huge drop in the pass rates of international of all nurses, even for U.S. based nurses. So the NCLEX test plan changes every 3 years. Sometimes the level of difficulty increases, and that everybody, whether they're U.S. or international nurse, they are the pass rates usually go lower.
Okay. So that's really interesting information. I know that James is trying to share his slides, so I'm not sure. We seem to be having a little technical hitch. James, if you want to let our team know which slide you wanted to share, so we can do that for you.
Okay.
And in the meantime, I see that we have a question from Archer. Archer is asking, in preparing NCLEX, do we need to focus on diseases specifically, or diseases then exist only in the US? Paul, if you want to maybe answer that question while James is focusing on the slides.
Yeah, if they would want to focus on diseases that are only in the US, technically speaking, yes. Of course, you would not see, for example, questions about cholera in NCLEX because that's a tropical medicine and they don't see it a lot here. You won't see questions about stuff that you only see in the Philippines or in the tropical countries, but you would see diseases that are not, being discussed in the Philippines or being taught in the Philippines, like Clostridium difficile or Rocky Mountain spotted fever or Lyme's disease. So I would tell students to start with American books, because if you want to take the NCLEX, which are created by US educated nurses, item writers, or from here in the States, then you would want to know what they're actually being taught in school, and that's what you want to study.
Okay, so thank you for sharing that information. James, I'm just seeing if I can share for you the slides.
Yeah,
Can
sure.
you all see my
There we go.
slide?
Yeah.
Okay, so is this the slide that you were looking for?
Yes. So if we can see here, if you can move to slide 3 first, please.
Okay.
The next
Let me
table. Yeah.
move there for you.
Okay, thank you.
To slide 3.
Yeah, that's it. So
Okay.
yeah, this is a lot of numbers, but basically this table, this came up from a research that I did that was published in a nursing education perspectives last year. So I tried to compare how Philippine nurses and other international nurses and overall international nurses fare on the NCLEX. So as we can see here, like if you see on this rightmost column, from 2002 to 2007, more than half were passing the NCLEX. So that was kind of good because more were passing. However, starting in 2008 and up to the present, more NCLEX examinees, international applicants, are failing the NCLEX. So that was really interesting because it shows about the quality of education that they have received, among other things. And this is for all international nurses. So I also tried to compare the Philippine educated nurses, because this research focused on the Philippine population when I made this study. And if you can see here, the pass rates also patterned the total international pass rates. It started to, it was high 53 to 58%. And then from 2007 onwards, it went as low as about 27.8 in 2014. So that's even less than 30%. So indirectly saying, it's like saying out of 10 examinees, only 3 passed. Okay, so that's how low it was, and then started to go up in 15, 16, 17, and even in 2020, the exams were, the pass rates were still consistent, wherein more than half were failing the exam. So that was the slide I was trying to show you.
Okay.
Yeah.
So let me stop share. Okay. So I think that's really, that is pretty kind of shocking statistics if you have a look at that. What do you think are some of the barriers for international nurses to become successful with the NCLEX? Why did we see such a big drop in those few years of the pass rate?
Yeah, if we look at the pattern, those years particularly, there was a huge drop in 2013. And if we look at the history of the NCLEX, 2013 was the last year that the level of difficulty of the NCLEX was increased. So 2013, 2016, 2019, in 16 and 19, the level of difficulty did not change. Yeah, they added some. There was a change in the test plan, but in terms of the difficulty, it was the same. So the pass rate was pretty much consistent. So the 2013 was the last time that the level of difficulty increased. That's why there was a huge drop. And my prediction is that having monitored the NCLEX for years, there's what we call now the NGN, or the next generation NCLEX. And it is a more difficult type of NCLEX. They are really writing questions that have never been used. I mean, it's really really hard. It's so hard that even nurse educators are having trouble. Like, how are we going to teach the students? How are we going to test them? In a classroom test. So it is my guess that in 2023 the pass rates will dip, not only for international nurses but also for U.S. educated nurses. So you were right, Tanya, when you said this is the best time to take the NCLEX, because it's already a hurdle for everybody to take the NCLEX now. How much more, 2 years from now?
Yeah, yeah. There really is a window of opportunity right now, both from an NCLEX perspective, an immigration perspective, and just from a bigger picture perspective of the demand that we're seeing in the US for internationally educated nurses. I've never seen such a demand as we're seeing right now. So that's good news for anybody who's taking the NCLEX. I see that we're getting a lot of questions that are now coming into the chat. If you have a question for the panel, please go ahead and put it into the chat, and we'll try and get through as many questions as we can in the next hour. So the first question that I see coming up here is from Alan Poe. And Alan is asking, hi all, I'm about to take the NCLEX hopefully this year. I'm still waiting for my eligibility. So best wishes, Alan. And I want to know how many months do I need to prepare for the review? Because the last time I touched a nursing book was in 2012. So it's been a long time. And this actually raises an interesting question. And maybe Paul, you want to maybe touch on this question. Is there like a correlation between the time when the person took their nursing boards and the time they take the NCLEX, and how that can affect pass rate?
Yeah, definitely. In my experience, what I've observed is the greater the distance from when you graduated until you take the NCLEX affects you really bad in the NCLEX. So, for example, if I have a student that will be taking the NCLEX that had passed the local board exam a year ago versus a student who took the board 10, 15 years ago, that student who graduated recently will probably more likely pass the NCLEX examination just because the knowledge is fresh, like the concepts is easy to recall because they barely graduated versus someone who has graduated several years back. Then you got to start all over again trying to get those concepts. A lot of NCLEX questions are prioritization questions and select all that apply. And those questions can only be answered if you have good foundation of concepts. So from the very basics of anatomy to the pathophysiology of diseases to the medications and lab procedures. So many things to understand. So I would suggest, if you've taken your local board more than 3 or 5 years, I would suggest to really take time to review for the NCLEX. If you are not working and you can devote your time to just reviewing, 3 to 6 months would be a good time. But if you are working, then that changes everything. Because if you're working 5 days a week, or 5, 6 days a week, then that doesn't really leave you a lot of time to review. So you would need longer time to prepare. So it's also up to you, like how much time you can devote for preparing for the exam. But NCLEX definitely needs 100% attention if you really want to pass the exam.
Yeah, definitely. I think that's definitely good advice. And Alan, so don't get too disappointed, because it doesn't mean to say that if you took your boards a long time ago that you're not going to pass. But at the same time, as Paul says, you really have to pay attention, because even if you're an excellent nurse and you've been a nurse for many years, it's still something that you have to do the work. You have to learn how to take the test. Dr. James, anything to share or add to what Paul has just given advice to Alan?
Yeah, I agree with what he said about, that's a concept which you call time lag, when you graduated until you took the NCLEX. And that has been consistent between, US nurses and international nurses. The longer you take the test, the lesser is the chance of passing. Now, other than those concepts being fresh on your mind, another factor that we need to consider is, the test plan changes every 3 years. So if you have not taken this exam, or the time lag is more than like 10 years or 8 years, then there had been several revisions already on the test plan, because the NCLEX is a reflection on what is the current nursing practice. So that can be one of the strategies that you guys can use, is to be familiar with the test plan. um, know what is current. The National Council of State Boards of Nursing, or NCSBN, updates it every three years. So not only on the concepts, but what is new, what is being used here in the U.S. Because not everything are captured in like one textbook. So you need to really look into a lot of those resources. So the test plan can be a good resource.
Okay, so some excellent pointers and tip there for Alan and for anybody else who's watching and looking to pass the NCLEX. I'm just thinking as you're speaking about a nurse that I was speaking to earlier last week. Her name was Julie, and she is a Filipino nurse. She had never taken the NCLEX before. She comes from a very poor family. It's very difficult for her to save up the money for the NCLEX. She was just talking about how she had also passed her boards. Also, it was even longer time ago than what Alan had given. And she's working. So that really makes it really a challenge. But again, it's about learning about the NCLEX and the pointers and tips that the expert panel are going to give you today that really can help Julie and so many other nurses.
It's not impossible. It's actually doable. So yeah.
Very doable. Well, there you go. You heard it from the panel. Let's talk a little. We touched on the work experience of the nurse and how that impacts the NCLEX performance. Can we talk a little bit more about that, and any more information to share about work experience specifically and how that will impact a nurse's pass rate on the NCLEX?
Dr. James?
Yeah, sure. So, the work experience is a kind of interesting variable to look into when nurses are taking the NCLEX. So, for one, those who are not working, they have all the time in the world to study for the NCLEX. Because
Right.
one of the differences between U.S. nurses and international nurses is that these are professional nurses who are already working before or while they're taking the NCLEX. So that is taking them. They're taking time away from studying. So that can be a huge factor. And actually, I just made a research, and I'm writing the manuscript right now. One of the findings is that those who did not work while they were studying for the NCLEX, they quit their jobs, they resigned, had a better chance of passing the NCLEX. However, for those who are working, these are the things that you need to consider. There was a study that was conducted wherein they said if you've been working in nursing for about 3 to 5 years, those have a higher chances of passing the NCLEX.
Mhm.
Um, those who are working in acute care units, ICU, because you need more critical thinking to deal with your
Mhm.
patients,
Mhm.
those were facilitating factors in having the NCLEX. So not only the duration or the length of work, but also the nature of the hospital that you are working
Right.
at. Um, and my dissertation focused on NCLEX experiences of international educated nurses, and it was interesting to find out that um, and I felt sad because I asked them, if you work in the Philippines or if you work internationally, which had a better, which helped you more in for the NCLEX, and almost all my participants said, well, my experience in the Philippines didn't help. because
Yeah,
things
that's
are
true.
done there differently. But when I came here to the Middle East, I came here to where they're currently working. Especially, it was a Joint Commission accredited
Hmm.
hospital, which is very much so patterned with the U.S.
Right.
Those experiences help them. So that employment piece would be it's really interesting, a very huge factor to consider.
Factor.
Yeah.
I want to add to that what Sir James was saying, because I agree with him. It's actually on my notes that nurses who had experience with JCI hospitals have very similar standards of care here in the States. So that actually helps them answer questions regarding standards of care, like doing procedures, drag and drop questions, like performing sepsis care or performing, like ICP management, CVP measurements, some things like that. But for those who have worked, say, for example, in the Philippines in a rural facility, I don't think it would help much because the practice in rural Philippines is very different than what NCLEX is looking for. You have to remember that students who are about to take their NCLEX have been preceptored 1:1 by another nurse for about a year before they take the NCLEX. So they're actually doing the job here in the States. I've preceptored students on their last year of bachelor's degree or on their last year of associate's degrees, and they're so different than students that I've preceptored in the Philippines. In the Philippines, I would preceptor 10 or a dozen in one group. Here in the States, I only have one. And that student gets all their learning for the entire day times 1 year. So when they take the NCLEX suctioning questions, super easy for them. Colostomy questions, super easy for them. They all know it. So if you practice in JCI hospitals, you would more likely have an idea of what we're doing here. And that's what comes out in the NCLEX. Item writers are nurses, and they're checking, what you should know as an entry level nurse. But if you practice in rural hospitals, in non-acute settings like clinics or diagnostic centers or call centers, then that would really not help. So you gotta study more, something like that.
So it's not to say you're not going to pass. So let's
It's doable.
clear on that.
Again.
It's doable, but it's just that if you are in that kind of
Yeah,
setting, you're going to have
yeah.
to probably put in more work.
Yes, that's true. So
Yeah.
that's why each
Yeah.
student will be assessed individually. In my opinion, in my case, what I do is individually assess it because all of them have different backgrounds and all of them can have different factors that can help them pass or fail the exam. So that helps me really give good assessments and feedbacks to them, like what we do in your case, something like that.
Okay. So for example, Paul, just to take that a step further, can you maybe share, like if you're speaking to a nurse for the first time, what are some of those questions? So it would be obviously how long ago did you pass your
Yeah.
boards? Two is what kind of setting you're currently working in. What
Yeah.
other questions would you be using to evaluate to be able to see how much input that nurse would need to in order to pass the NCLEX?
Right. So in my program, I usually have when they go inside my program, part of their orientation is an NCLEX profile questionnaire, is what I call it. So they definitely would have to answer questions as, is this your first take or retake? Because that changes the ballgame. If it's your first take, you don't have a lot of expectations with NCLEX. If you're retaking it, then you're probably scared with NCLEX and you're probably scared to do mistake again. That's one. And then another one is what application process are you in right now? If you tell me you already have ATT, then that tells me I only have less than 90 days to prepare you. But if you're barely processing, then that tells me we have ample time to prepare you. Are you working or not? How long are you working? And what is your pre-test? I look at those questions too, and I also ask them like, where are they located? So sometimes, Filipinos who are in the Philippines usually have more time because they live with their families. They can review. Some people will help them. If they're working outside the Philippines, then they don't have people to take care of their kids, or if their spouses are working too. So that kind of divides their time from the work. So those are the things that I look at. But mainly my highest like weighted average, if I look at it, is what they scored in my pretest, because that tells me the knowledge base for the student and that tells me how long we can prepare you. So but there are different factors. Education is also important. It's It's there's I haven't done research on this and I cannot correlate it, but people who have graduated from reputable schools in the Philippines that I know, because I've taught in the Philippines for 12 years as a local board reviewer, have also good passing rate because their foundations during the school were really good. But if you graduated in a not so good performing school in the Philippines, that can also affect your preparation for NCLEX. It's a lot different than Philippine board exam. It really requires a lot of critical thinking. So I look at that as well.
Okay.
Well,
So
if I,
it sorry, Jen, it really sounds like it's a one size fits one approach. You know, it's not a one size fits all.
Yeah,
There's so many different
exactly.
factors that you need to
Uh-huh,
take into account. And
uh-huh.
Dr. James, I'm just thinking, I'm sure you have, a lot to add to what Paul has said, but I'm just thinking as I'm talking, I know that in our discussions previously, you've done a lot of research on nurses who went to Canada, who went through bridging or education programs there, and how if they had a broader education foundation, that also helped them to pass the NCLEX. Can you talk a little bit about that maybe?
Yeah. So just a little context, a little background. Canada adopted the NCLEX in 2015, so they now require their local graduates, Canadian nurses, are now taking the NCLEX to practice nursing in Canada. And of course, those international nurses who also want to practice in Canada have to take the NCLEX. So in one of my research, I also look into the pass rates of international nurses who took the NCLEX in Canada and compared it to those who took it in the US. And it was really surprising that um, when you take the NCLEX in Canada, you have a higher chances of passing. I mean, they have a higher percentage. Like Philippine nurses who take it in the US will only have like about 45, 44%. But when they take it in Canada, the passing rate is like in the 70%. So the percentage of passing is really higher. And why is that so? And looking at how the Canadian processing for, I mean, to evaluate their eligibility to take the NCLEX in Canada, they require them to either repeat some of their education. I mean, because our education is not comparable in Canada. A bachelor's degree in internationally is like an associate's degree in Canada, so they will require you to have other classes, and that's another factor. Or there's what we call bridging programs. These are programs that will help them transition to practice. So it's not only about the knowledge about nursing, but the skills and how do we do things in Canada. So I was in my discussion and that finding, and my article I think was the first research that observed that interesting data that international nurses who took the NCLEX in Canada have higher pass rates, and it can be explained by these bridging programs and the evaluation process that they do for international nurses.
So that's a really interesting statistic. Can you all see the screen?
Yeah.
Yeah. So you can see here, Dr. James, if you want to just go through this first line, I think that kind of like clarifies it.
So this table it came from my research. These are the top 10 countries who are applying for the NCLEX, and as you can see here, the Philippines is about almost 60% are of the international nurses are from one country, from the Philippines. Now, so I tried to compare how they what the passing rate is in the U.S. That's the third column, and last is the Canadian. I called it the Canadian NCLEX, although they are the same NCLEX. Okay, these are the same NCLEX, it's just a difference on where they took it. And as you can see here in the numbers, like for Philippines, those who took it in Canada had a 3 out of 4 passed, while in the US only 2 out of 4 passed, and that is consistent all throughout the different countries.
Mhm.
Here, Puerto Rico and Cuba, I mean, it says nobody took that in Canada in those years that I was studying the NCLEX. So it was really kind of interesting
Right.
to have this data.
Yeah.
Mhm.
Wow. This is really a fascinating slide. So if I'm understanding correctly, what you're saying is that the pass rate, because the NCLEX is the same, it's the
Uh-huh.
same exam, but the pass rate is higher if it's a Filipino nurse, for example, that's in the Philippines, sorry, that's in Canada and has gone through a bridge training or
Mhm.
educational training, additional educational training, as opposed to maybe a nurse that is sitting outside of Canada that hadn't gone through that educational, additional foundational training. Is that
Mhm.
right?
Yeah, that's correct. Because if you look into how they process these applications, that's a huge difference between somebody who's taking the NCLEX in the U.S. versus Canada. So that's a huge, I would say, confounding factor on the NCLEX results.
I
Well,
think that approaches closely the 73. This is the first time I've seen the data, but the 73% Canadian Filipinos that are taking the exam in Canada that have taken the bridge program closely approach the national like passing rate for NCLEX, which is 86% for US educated, which tells me that education is probably, we cannot correlate because we didn't study a correlation, but probably is the biggest factor. So if you look here in the United States, like I said, they're precepted students, and they all take their, as soon as they graduate, they only take 30 days or less. They take their NCLEX, they come back to the hospital, they pass the exam right away, 75 questions. Like it's not hard at all. Like it's not difficult at all. But you got to consider US educated nurses, nursing school here to qualify is so different. You have to have prerequisites, you have to have good GPA, they're very selected. So you cannot just enter nursing school just because you want to take nursing. You got to prove your spot. And then, of course, they take HESI exit exams or ATI before their NCLEX, which has a good correlation of their passing. So now eight out of 10 nurses, US educated, will pass the NCLEX versus four Filipinos that will take the NCLEX. Out of 10, four will pass. So I guess education is a big factor because if you are educated in the US or Canadian curriculum, which mirrors what the NCLEX is all about, then you're more likely to pass versus if you are foreign or internationally educated. So now to bridge that gap, that difference in education, I think um, doing self review or entering a review program is important in that sense that everything that was not taught to you in your nursing school or in your experience, you should bridge that gap by studying more. By seeking more information or studying books or enrolling in review programs that can help you bridge those gaps. Right? You cannot, like what I tell students, do not like if you take the exam, do not focus on your strengths because you already know those stuff. Focus on your weaknesses. What are your mistakes? So if I gave you 100 exam items and you only got 30, then you got 70 items to focus on. The 30 items, we can not worry about that. So you got to bridge that gap. Well, what is your knowledge gap? Or what are those things that you don't know? You got to find help or do self review to bridge that gap. Yeah.
And it's interesting that you mentioned about I want to touch base on the academic part because being an educator both in the Philippines and here in the U.S. I've seen the difference in the curriculum and how we approach testing and teaching. So that already is a huge difference because we teach things differently, we test our students differently, and regarding academic factors, their GPA, your general average in college, has been identified as the strongest academic factor to predict your chances of passing the NCLEX. Now, this has been studied in U.S. Educated nurses, and again, the lack of literature in international nurses is driving me to do research on that. So,
and we love
um,
that you're doing that, by the way.
yeah, yeah, so you have to look. I mean, that would be applicable because it makes sense. If you did good in nursing school, I mean, they will say, oh, well, I was a flunker in nursing school, but I passed the NCLEX. Say, good for you. But what the body of literature is saying is that the GPA is the strongest predictor of your passing on the NCLEX. And if you break down your different subjects in nursing school, again, research say that the subject that is highly predictive of passing the NCLEX is medical surgical nursing, and it makes sense because if you
Right.
look at the context test plan, I mean, more than half to 75% is going to be med surge.
Exactly.
Pediatrics is med surge, so
Right.
physiological adaptation and then pharmacology. If you put them together, that's already three-fourths of the NCLEX. So,
Mhm.
and interestingly, the second strongest what do you call this subject that can predict your chances of passing the NCLEX is psychiatric nursing. So yeah,
Wow.
med surge would be, and that also, yeah, psych nursing. would be it came out in the studies because in other international nursing education studies, it's interesting to know that they don't have psych nursing in their curriculum. So when these international nurses take the NCLEX, they I mean that's a huge piece that's missing. I have come across literatures like nursing curriculum in Mexico, in Africa, and Eastern Europe, Eastern European countries. They don't have psych nursing in their curriculum.
Oh,
Mhm.
wow.
So that already
Interesting.
is a huge, missing part when they take the NCLEX.
And you, if you think about it, in the actual NCLEX, there's a lot of psych modalities, medications, treatments. So that's a huge gap already if you take the
Yep.
NCLEX.
Yeah. This is such a fascinating topic. I'm just loving this because I think we're just learning so much from the literature and from the panel about the different factors that will help an
Hmm.
international nurse pass or not pass the NCLEX. And
Hmm.
again, just to be clear to everybody watching, it doesn't mean to say that if you didn't come to from a specific school, get a specific GPA, work in a certain setting, have graduated within a certain time frame that you're not going to pass. So I
Those
just
are
want
just
to be
factors.
clear. Yeah, the Lafora Talk Show is all about hope.
Hmm.
So, and hope, and obviously you have to do the work. It's just that it's important to educate yourself. And that's
Right.
where I'm just so grateful to the Lafora admin team for giving us this opportunity to do the Lafora Talk Show, to spread this information and for nurses to educate themselves so that they're not going into the NCLEX blind. And they
Exactly.
know exactly what are their strengths, what are their gaps, and what work they need to do to be able to accomplish their goal.
Yeah, I tell the students that
Yeah.
NCLEX exam is like an investment, like you got to put effort into it. You put a lot of money into it. When I took my NCLEX, this is a long time ago. This was 2008. It's so funny to say that I've already passed my NCLEX 13 years ago. Uh, it's so funny. But yeah, when I took my NCLEX and I sat on the screen, and everybody would feel this, all my students are taking the exam, and they said I was so anxious during the exam. I was like, everybody went through there, everybody had to sit on that exam. I sat in my exam, and the first thing that came to my mind, and I actually saw my mom on the screen, and she said, "Okay, we spent $500 for this exam. We gotta pass this. No other option. We
No
cannot
pressure.
fail. No pressure at all. We cannot fail." But she didn't tell me that. My mom is very supportive, but that's what's going
But
on
that's
through my
the
mind.
voice
I
that
cannot.
you heard
Yeah,
in
like
your
I
head.
cannot fail this exam. It's a $500 exam for someone who's not that well off. And my mom had to really work hard for that money to put me to NCLEX. I mean, for nursing school and then NCLEX. I cannot fail that exam. I really cannot. So
Yeah.
I was like, I gotta focus. I cannot afford to pay another $500, and that was 2008. But yeah, it is an investment. You
I,
gotta make sure, yeah,
Yeah,
you
I
pass the
think that's
exam.
a great analogy. This is an investment. And that is where, for anybody who's watching, if you have not yet passed your NCLEX, pay attention to what the expert panel are saying. If you have friends or colleagues that have not yet passed the NCLEX, please tag them so that they watch this session. It's really important to educate yourself so that you know what you're up against and you can invest wisely.
Right.
I'm going to move to some of the questions in the chat. And if you have questions in the chat for the next 15 minutes, because I cannot believe how the hour is flying by,
Right.
please put your questions into the chat and I will get through as many questions as I can for the expert panel. And I also just want to give a shout out to Dr. James. I see he's like rubbing his nose. Just for everybody to know, he has not been well, but he was so committed to being here for everybody and for sharing this valuable information that he's here, even though he has not been well. So we hope you are going to be feeling better soon. Okay, so we got a question from Marcus. And Marcus is asking Dr. James, please share some tips for choosing review materials and a review center, also the average duration for intensive review. And Marcus is watching from North Carolina.
Okay. Yeah, for Winston-Salem. I think I know him. Yeah. So
Oh,
first of
okay,
all,
there you go.
yeah, I think it's one of the nurses who just came in last month. So I think, yeah, first of all, choosing a review material or review program you have to do a self-assessment first. People will say, this is the best resource. Do this and do that. What I always say, even to my students, the first session for our NCLEX class is do a self-assessment. What works for you? When is the best time for you to study? Do you think you need more content versus do you need more practice questions? Because if you feel like you have to catch up on a lot of nursing content, then you have to use materials that are, more heavy on content, and then do the practice questions on the later part of your review. Okay, so it all depends on your needs. But some people will say, I think I'm pretty confident with what I know. I just want to do practice questions. Then I would suggest then get those books that are really more into um, uh, practice questions. These are reviewers that are pure Q&A, questions and answers. Um, for review centers, I would like to say this. I know there are like different review centers left and right, but go for a review center that really knows by heart what's going on in the U.S. nursing practice, because they will be teaching you about what is going on in the U.S. nursing practice. A lot of things, a lot of those reviewers can uh, talk things about disease processes based on what's in the book, but what is really going on in here. So you have to do your research into who is teaching it. I mean, because it has to it will matter. In terms of how long would it be, again, based on studies, my research showing that if you study within 3 to 6 months, okay, within 3 to 6 months, you have a higher chances of passing compared to those under 3 or more than 6 months. So that can be a good variable to consider when you prepare. And I just remember one important thing, Tanya and Paul, if I can just mention, it's piggybacking on what Paul mentioned earlier, that what questions do you ask your reviewees if they study? I think one important thing is that, again, this has not been in the literature, but it's coming out in my article, is how many times have you passed your Philippine nursing licensure exam? Because the data from my study says that if you just if you pass the Philippine nursing licensure in one take, you have a higher chance of passing the NCLEX. So that is like the first data that will point out to the influence of a national licensure and its correlation to passing the NCLEX. So
Interesting. Oh, that's a very interesting tip that you just shared with us.
and,
And that actually, sorry, did you have something to add, Paul? Oh, so that actually takes me to my next question, because I see there's a question from James. So James has put into the chat, hi, I'm working in the Middle East for almost 11 years as a med-surg nurse. So med-surg is good, James, you heard that. I failed NCLEX last 2017. It's been my dream to work in the US. Can you suggest the best reviewer for NCLEX? So I know we've spoken about choosing a reviewer, but what advice would you give to a nurse that has failed, or maybe even failed more than once?
If I'm to answer that, here's the thing. So I have students who've failed in the past enrolling in my program. First thing I ask, where's your candidate report? Send it to me. And then I analyze it. You know why? Because that will tell me what's your weakness. Now, if eight, so there's 8 categories. If all of them or most of them tell me it's near passing standard, or near passing standard or below passing standard, we got a lot of work to do. You got to start with concepts building or foundation, right? But if it tells me that half of them are above passing standard and the rest are near passing standard, then maybe let's just focus on question drills. So if you are a retaker, show me your candidate report and I can help you analyze what's going on. But you can also analyze it yourself. You don't have to ask me, right? If it says near or below passing standard, you got to build your concepts in there. If it says management of care, the NCLEX test plan is made available for free online by NCSBN. It tells you everything about management of care, ethical, legal, delegation, prioritization of skills, HIPAA violations, Good Samaritan law, etc., etc. If it says your score is low in pharmacological parenteral therapies and you're below passing standards, well, that's all the drugs. That's also including parenteral therapies, TPN, CVP management, PIC lines, etc., etc. So all the information is available online. So if you cannot diagnose yourself, get someone who can read it for you and interpret it for you. It's like consulting a doctor, right? You can go to the lab and get your labs, and then all it gives you are numbers. What is this? All right. Go get someone who can understand it for you if you can. So something like that. But yes, it's doable. I have students who've taken 5 times in the past, and uh, um, when they did it with me, I'm not saying I can make everyone pass. Again, it's a partnership. I told my students, I do my part, you do your part. But that student focused on the sixth time. I said, we're not going to rush this thing. We're going to build your foundation, and then we're going to do your question drills towards the last part. That for me is one effective strategy.
Okay. Okay. So again, the good news is there's hope. It doesn't matter if you have failed or if you failed many times. Don't give up. Now is the window of opportunity for you to take the NCLEX exam. Dr. James, is there anything you wanted to add for somebody who has failed once or more than once? You're on mute. You're on mute.
Yeah. Because I was coughing. So I have a basic formula that I always share with my students. Like how to be an effective test taker, and this is not only applicable for those who fail, but also if you're a first time passer. Is you have to be, of course, number one, very important thing is you have to have a solid foundation of your nursing content. You
Mhm.
need to know your material. And number two is you have to be a good test taker. You have to know your test taking strategies. So. You may know all those concepts, but you get rattled if you take the exam. So it may be a test taking issue. So
Right.
other students may they're average in terms of their academics, but they are good test taker. They have learned the skills. Then they can pass. So it is a combination of what you know and how to take the test, and review providers will train you on that. And I would like to also emphasize that when you do your practice questions, of course, you want to identify your strengths and weaknesses. There's a tendency for students to study the topics that they love, and they try not to study those that they don't like. Like,
Mhm.
I don't like OB, so I will not study my menstrual cycle topics and all that. But focus on your weakness. This
Mhm.
is an opportunity wherein focusing on your weakness would be a very good advice. And whenever you are answering questions, pay attention to this. Make sure that you get at least 65% correct,
Mhm.
regardless of how many items. Because research shows that if you are consistent with 65% and above, then you are most likely going to pass the NCLEX. So in other words, if you're taking 10 questions, you just can take 10 questions per day. You should be able to answer correctly 6 to 7. If you are answering
Mhm.
50 questions per day, get that 65% mark. It's about 35, 30 to 35, 33 correct answers. So look at your batting average. Don't just answer and answer and answer. Of course, it's important, but okay, pause. I want to compute. What is my average within this X number of questions? Hit that
Right.
mark, 65%. Don't
Okay.
stress yourself out with a 90% or 80%. Nobody's gonna get that score. But
Right.
65% will build that confidence that you
Yeah.
are, and that can be a good mark for you to say that, okay, am I ready? And you have to keep track of your performance. If you've been in diagnostic tests, Paul said if you were 30% on day one, then slowly work on
Lots
that
of work to do.
number day by day.
Right.
And when you're
Mhm.
consistently in a plateau of 65% and higher, then go for it because you will make
Al-
it in class.
yeah. Also, I have another good test taking strategy. I mean, reviewing strategy for those who failed. If you failed, you've identified the topics that you are weak at. When you create your study plan, I always tell my students to create a study plan. I'm taking my NP boards too, and I have study plan every day. So right now, I'm very close to my NP boards. I'm taking quizzes every day, just like what you guys are doing for NCLEX, right? Um, Study your weaknesses first. I have a student that failed the NCLEX, and she sent me the candidate report, and the report says she's above passing standards for health promotion, and which is OB and pediatrics and psychiatric. and then she failed, and then she started reviewing again. And I said, "What are you reviewing right now?" She said, "Psychiatric." You know, the tendency for student is to review whatever they like. Their favorite subject, which they always get consistent high grades, is what they always review, and then spend less time to their weaknesses. Reverse the process. You failed because there's a reason, right? You did not focus on things that need to be focused. Reverse it. If your pharmacology is the lowest, start with pharmacology. All right. You graduated nursing already. You don't have to start with fundamentals before you go to pharmacology. That's only when you're studying nursing. That's structured education. But now let's reverse it. Do pharmacology or do medical surgical nursing and then pharmacology. And then your favorites, don't spend 1 week reviewing your favorite topics. Because I would tell you right now, I can give you a quiz on that and you will still pass it because that's your favorite. That's called bias. So reverse the process. So there's a lot of stuff,
That's a
and
good.
you develop these strategies that you tell students if you've been teaching them for a long time. And it's funny because 65 to 70% is also my threshold for my students, which is being validated now because of the research of Dr. James. So there's a good
Good synergy.
correlation to that. Yeah.
Yeah. Good. Okay. So some really good pointers, advice, and tips coming from the panel. I actually had a question that was sent to me directly, talking about test taking. Just general test taking. This question came from Angela, who has a very difficult time taking tests. And it sounds to me like the feedback that I'm getting from both Dr. James and from Sir Paul is that you have to have a strategy, and you consistently are meeting that threshold of a minimum of 65%. That's also going to help your confidence, Angela, because that's where I think a lot of that test taking anxiety comes from, is just not feeling confident. Would you agree with that, to the
I
panel?
agree.
Yeah, test taking strategy can make or break. You might be
True.
smart as a student, but you don't know how to take a test. In our nursing program here at the university, we I handled this NCLEX class. It's a one-man team, and part of I spent one session on teaching them strategies. These are the bullets on how to be a good test taker, and they will tell me like, "Hey, why didn't you teach this to us? When we were starting nursing school, why on the last semester? Because this is your NCLEX time." And when they pass the NCLEX, and I ask them, so yeah, test taking strategies really will help. Because even if you don't
Right.
know the concept, if you know how to eliminate questions, you can
Mhm.
you have a higher chance of really getting that correct answer. And if you're looking for resources, I know you have books, you have those NCLEX books. And sometimes we look at the table of contents, we want to jump into pharmacology or med search or psych.
Right, right.
Read the first two chapters, because those introductory chapters, it
Are
tells
the
you a lot
tips.
about how to take a test. There are specific pointers. Use
Mhm.
them.
Right.
I know we don't usually pay attention to those. It's boring. I'm not learning anything. But that is where the test taking strategies are in the first few chapters of any NCLEX book, right, Paul? Would you
Right.
agree?
Yeah.
That's true. A lot of NCLEX books and review programs would always start with introduction. But tell you what, I guess majority of students would skip the introduction. They want to go straight to the middle of the thing. But there's a lot of things that you can learn. There's a reason why we do orientation, or in the class we do course objectives and stuff like that. We want you to focus. And I want to also say this thing. Exams are created because we use it, educators, to validate learning. And Sir James is right. You can be book smart, and I can be lecturing, and you're answering all my surefire questions. You know what I mean? Like, you can be the best one in recitation, and you're good with recall. But NCLEX does not test recall, because if it's a recall question, that would be an easy question. If it asks you what sound do you hear in the lower lobes of the lungs, I would say that's an easy question. That's a recall question. That's not an analysis. That's not application questions. But test taking strategy is, I would say, underrated. Not a lot of students appreciate it, but it can really make or break you. So here's the thing, what I always tell them. Suppose you have 6 months of preparation for the review, and it's one of my slides, but we don't have time to show that, right? Um, you spend 3 months understanding concepts. You spend the last 3 months answering questions of 50 to 100 a day, 4 to 5 times a week. It's mental training. All right. It's teaching your neurons to create memory pathway of how to answer the question, how to understand the STEM question, how to do your test taking skills, elimination, focusing on the positives or the negative answers, etc., etc. It also helps you gauge what you're missing, what you need to read on. So test taking is very, very, very important.
Wow. Okay, so some amazing tips and pointers there. In fact, I'm just looking at the chat, and I see there's a question from MJ who's saying, I'm working in the Middle East. Do I have to enroll in a review center or do self-review? And it sounds like, I mean, obviously, if you are able to afford doing a review course, and there are some phenomenal courses, as both Paul and James know and advocate, that are available for you. But if you are not able to afford that, as Paul said, invest in yourself. So please listen to the advice of the panel of how, if you are going to do self-review, of how to go about that in a structured and very strategic way.
If you don't have money to review, only two things that I would tell you. Get a Saunders book. When I took my NCLEX, I didn't have money for review centers. Like I said, we're not well off, and my mom only have few money left to pay for my NCLEX. Do the Saunders. When in 2008, I reviewed the book 3 times from front to cover, from cover to cover, from back to front to back, 3 times until I can master it. And the other one, and there's question banks in there as well. I think 1,000, 2,000 questions. The other one is the La Charity, prioritization and delegation. So that's my secret. If you can't afford a review program, those two things will really, really help you pass the exam.
And if I also may add, I know we ran out of time.
Yeah.
One of the questions I ask my respondents in my research is that what kind of review preparation did you have? And there's a correlation to the method of preparation and their passing. It turned out that those who were in a review center had a higher chance of passing. It's significantly correlated to passing. But again, it's not saying that if you have a self-review, you will not make it. No, it's more of a higher chance of passing, because let's face it, if you are in a structured review program, they can guide you. If you're self-review. But I know a lot of people have studied, using self-review. Just imagine those times before the internet. I took my mind in 2002. No internet, no resources. I just have my book, and like Paul said, you just have to test yourself like a million times.
Right.
Your brain will get those wrong answers. So it boils down to what is your situation, what is your work situation, what are your resources. Make the most out of it. Do a self-assessment. I just thought it was kind of interesting to mention, because if you need help, because what studies have shown also is that if you didn't make the NCLEX the first time, there's a lesser chance of passing on the second time.
It gets tougher because all the questions that you already had the first time will be taken out from your pool, and you will be given more like new questions, something like that. You will not be given the same question if you already failed the first time. So those questions that came out will probably be different the next time. So it gets tougher because the pool becomes smaller, and you get the questions that shouldn't be coming out. But hard questions.
Hard questions.
Like the out of the world questions, what I say.
Yeah. Okay, well, I cannot believe that an hour has flown by. We are actually out of time. This has been such a fascinating discussion. I thank the panel, Dr. James and Sir Paul, so much for your time. I really think that the input, the insight, the information that you've shared today is invaluable for any nurse that is looking to take the NCLEX. As I said at the beginning of the session, there is a window of opportunity right now, not just because the difficulty of the NCLEX is going to increase in 2023, but also because the visa bulletin is current right now, which means the timing to apply for a green card is the best that it's ever been. Right now, and also because the demand in the US is higher than I think anybody has ever seen it in ever. I mean, I was going to say many years.
We're
Yeah,
so short-staffed, so
yeah.
please come here because we need help. I've
Exactly. So now is the
from
time.
the nurses working on the floor, I would tell you right now, every hospital that I've worked at, and that's like four in the last year as a travel nurse, short staffed everywhere from ER to the floor. It's crazy, unbelievable. ICU nurses are here in Texas are doing three patients instead of two. So please come over here. We need your help. And nurses are growing older. We need fresh young blood in here.
Exactly. Look at Paul running his hands. Come
Come on
over.
here. And there's so much
So,
opportunity. I
yeah.
love it here. I didn't regret coming over here. There's so much opportunity. You want to teach, you want to be clinical nursing, you want to be like what Mom Jean is doing. She's still a nurse, but she's working in the office and making good money. There's a lot of opportunities for nurses. Things that were deprived to us when we were in the Philippines. There's so much opportunities to make money from. But start in the hospital. It will open doors for you.
Exactly. It might just be a stepping stone.
Mm-hmm.
And I think the two of you are just so inspirational. The careers that you both have, that you have both had in the US is so inspirational for so many people to see what's possible when you come to America. The American
Right.
dream is very much alive and well.
Right.
And we, as Paul said, we need you. If you are interested in coming to the US, now is the time. If you have not yet passed the NCLEX, please address this. There is a window of opportunity right now. So I want to finish off and thank the expert panel. This has been the most fascinating hour. I want to thank again the Lafora admin team for the amazing work that you do. Really, nurses helping nurses. It is just so inspirational, and it's truly an honor to just be even a little bit part of that. And I just want to thank the Lafora admin team. I also just want to give a shout out to Miss Jean. If anybody missed the teaser from last night, she gave some excellent pointers and tips of the process, just kind of the practical process of applying for the NCLEX. So if you missed that, please go back and watch it, or tag your friends or colleagues that need the NCLEX as well. So thank you to everybody for watching. The Lafora Talk Show Expert Edition will be back next month. Every month, we will be tackling specific topics. So it's not going to be what we did last year, where we're kind of documenting nurse journeys. This year, we have a new format. Really excited about it. We're going to be tackling different topics that affect international nurses. And the next topic that's going to be coming up is transportation in the US. How does that
Interesting.
work? How do you buy a car? How do you lease a car? What is the difference between the two? What are the different avenues of transportation? How do you get a car loan? So all of those topics will be handled next month. So please tune in. Oh, and one last thing before I forget, next week for the whole week, we'll be doing a Back to Basics boot camp. For the any nurses that are interested in the immigration process. Many nurses don't know what is the I-140, what is premium processing, what is prevailing wage, how does that affect you when you accept a job in the US, and what questions to ask when you are interviewing with an employer. So please check out the Back to Basics boot camp that will be shown next week. We will be doing it every day next week.
All
Thank you,
right. Thank
everybody.
you, guys.
Paul,
Thank you,
best wishes
Tanya.
for your exam. And Dr.
Thank you.
James, we
Cross
hope you
fingers.
feel better.
Thank
Thank you,
you.
everybody.